Drug addiction or drug use disorder is a major issue facing our cities and in fact all parts of society. It's an issue which is often seen as too complex or too taboo to deal with. But here in Durban, through an innovative partnership, the city government, academics, NGOs, business, the police got together to find a way forward. And it started here, inside the iconic Moses Mabhida Stadium, where during South Africa's toughest levels of lockdown, a homeless shelter was set up just inside. The goal? To help those with drug use disorder through what is called opioid substitution therapy. I meet Monique Marks, the project champion. Curious to find out more about the issue of drug use in eThekwini, she put herself in the back of a police van. This gonzo approach led her to discover methadone. Since 2017, Monique has been a central figure in promoting a harm reduction approach to drug use. She and Michael Wilson manage the Bellhaven Harm Reduction Centre. Here, people with drug use disorders come and receive methadone, an opioid substitute which helps alleviate withdrawal symptoms associated with heroin use. They were called on by the city in response to the COVID-19 crisis to implement the opioid substitution program in 2 shelters, which was set up so that the homeless population could follow lockdown regulation. This project demonstrates a unique symbiotic partnership where the city enables non-state actors to make a positive change in their field of expertise in a way which has a wide-ranging impact on the city. This project has not just been championed by NGOs and government departments. Progressive corporates such as Urban Lime and FNB have seen the value in what Bellhaven has to offer city spaces and have provided funding and connection.
The partners that are involved, obviously the city provides the building. We don't pay rent for the building, we don't pay rates, we don't pay electricity, we don't pay water. So that's a big saving. The city also provides static security 24 hours a day. Obviously the running of the program is not done by the city, that's done privately by an NGO called Advanced Access and Delivery, which Michael Wilson heads, by the Urban Future Centre at DUT, which I head, and with other NGOs. I'll just mention 2. The one is TB HIV Care, that run a needle syringe program from here and provide psychosocial support, and the South African Network of People Who Use Drugs. The problem is that there isn't the provision of resources for cities to run harm reduction programs. That's really where you get the need for partnerships, because it really is the non-government business sector that can come in and do what we're doing here, which is to say, provide us with the basic facility, provide us with a building, provide us with the support to feel safe in the spaces that we're working, provide us with the moral authority by your officials to go forward with a program like this.
Monique, which exact or government departments and agencies actually get involved in a project like this and make the magic happen?
We needed the support of the Deputy Mayor, and actually the Office of the Mayor has also been very supportive. Urban regeneration, because this is a catalytic project for urban regeneration.
Absolutely.
The Department of Health, Social Development and Safer Cities is actually the custodian of the building that we use, and very importantly Metro Police. But what has been amazing is the support that we've got from all sectors of the community around, saying this is what we needed. We needed an intervention that assisted in helping people who use drugs to resolve their drug use disorder, and in some way also to take them off the streets.
It was just this incredible coming together in terms of management between government, between NGOs, between the private sector who were giving a lot of funds for this, as well as private medical centre, working together in unison, creating this enabling environment for the homeless for the first time.
If other cities and towns wanted to replicate this approach, this innovative partnership, where do they start, and is this a big budget production?
All we needed at that point was a table to work from, chairs for the medical staff and the social workers to be able to use, just to be able to sit occasionally and have one-on-one interactions with our clients, and obviously we needed the medication. Other than that, you can do something like this in a very, very, what I call frugal institutional space at a very low cost. The other city that's been doing really well in terms of harm reduction, and it's important that we mention this, is Tshwane, where the local government there does work together, in particular with the University of Pretoria, in providing services to people who use drugs on quite a massive scale. We run fairly differently because our program is what we call extremely low threshold. That means that there are almost no barriers to access at all. It means you're really opening up to almost anybody who presents with a drug use disorder. I think it's really important that cities begin to speak to each other in South Africa, and that we begin to talk about what evidence-based solutions we have to urban problems, like the growth in drug use. That would be a really good place for cities to start collaborating and learning from one another, using, for example, Durban and Pretoria as case studies of where cities have actually backed up programs.
Every day, between 150 and 200 clients come here to receive their methadone dose. The transformation is radical, extending far beyond the lives of those receiving treatment from the centre. The ethos of the program is harm reduction, an approach to drug use disorders which focuses on positive change, working without judgment or discrimination. This is way more than a pioneer project to support homeless drug users. It has now become, as Monique calls it, a placemaking project. The surrounding streets and parks have become spaces to pray, linger, and play. Water is provided for drinking and washing, and the clients have taken responsibility for the garden's upkeep. The centre itself, which was once a dilapidated building, has had its original function restored as a community centre.
So really what we want to do is to break down the sort of divisions between people who use drugs and other people. I mean, it's a false division anyway. And so what we want to do is to activate the space so that people use it, and that there's a sort of communication and engagement between people who don't see themselves as active drug users and our drug use community.
Before this, I never looked at the homeless people the way I look at them now. They have such amazing stories behind them, and it just takes a little bit of time to listen to them and understand them. So it's a huge impact, it's a huge difference.
The big breakthrough is how the centre and its partners, such as city officials and police, think about urban issues. Drug use or homelessness are symptoms of deeper issues and will not be resolved by punitive intervention. This has been recognised by the Metro Police, who are partners in the programme. They now approach law enforcement in a more empathetic and holistic way. What we've learned today is that this space, the Bellhaven Harm Reduction Centre, is more than just a building to provide treatment and services to those suffering with drug addiction, but it's a placemaking project, a public space, an idea that could be rolled out across South Africa.